All right, see you later.
Have a good day.
Okay.
Bye.
My name is Randall Stafford. I'm a doctor at Stanford. I not only do research in Stanford University, but I also practice medicine at the Stanford Hospital and Clinics. I think I got interested in cycling when I was a teenager because I liked the freedom of being able to get out of the house and actually go somewhere. And the bicycle allowed me to do that. I basically have just been cycling ever since. I was diagnosed with kidney disease when I was 24 years old. Had no inkling at all that there was any problem up until the point that I had a pre-employment physical. And at age 24, to suddenly have to face this issue of being on dialysis and needing to consider transplantation was a big shock for me. After being on dialysis 3 times a week for a year, I was finally able to undergo a kidney transplant from my youngest brother. After my transplant, with the new energy that I had, I think I became even more physically active than I had been prior in my life. And soon after that transplant, I became involved in participating in the World Transplant Games. I've come away from those games with a lot of gold medals and silver medals and bronze medals. I think it really indicated to me the real value of physical activity. Certainly physical activity is a big part of what I recommend to many of my patients. And even for people with very debilitating physical conditions, physical activity still plays a big role in the strategy to try to keep them healthy and to keep them functional.
When I met Dr. Stafford, 23 years or so after first kidney transplant, I didn't see a transplant recipient. I saw an athlete. To me, this was not somebody that was 50 years old and 20 years of immunosuppression. If I'd not been told, I could have guessed it was a 25-year-old man.
My transplant from my brother Derek went extremely well. As time went on, that kidney began to function less well.
His first kidney was failing after 23 years. And if you have put that in perspective, this is already way above what would have expected. The average half-life of a kidney transplant from a living donor nowadays is 17 years. But in the past, when he had his transplant, it was much shorter. So that kidney has lasted beyond expectation.
If anything, I think my physical activity really helped keep my blood pressure low and kept that kidney healthy for as long as possible.
In November 2005, I had the pleasure to participate to the care of Dr. Stafford. I'm a transplant surgeon. I did his repeat transplant. His wife was a donor, so I did the donor nephrectomy and implanted the kidney in Dr. Stafford. One thing that actually amazed me is that when I did the surgery, I didn't have somebody that had 20 years of immunosuppression and chronic disease. I really did surgery on an athlete. And that really was obvious with his recovery, but also with the quality of his tissue.
This year, I've gotten very interested in the senior games, and the U.S. senior games are coming up in August of this year, and they're happening here at Stanford. This is the first time I've participated. I've just turned 50, and that's the minimum age for participation. And I view the senior games as something that's going to keep me being motivated to keep in shape for a while to come. And certainly, knowing some people who are in their 70s who are continuing to cycling gives me a lot of hope that I'm still going to be doing this a long time from now. I really want to demonstrate to people who have had transplants or are thinking about transplantation that it's a viable option and that you really can be successful and continue to be very active. For anyone, it's important to sort of be able to recognize the things that drive us and that inspire us. And certainly my history of having had the 2 transplants and participating in athletics is something that's very important to me. Being able to compete at this level makes it all the more rewarding for me. But I'm very thankful to my 2 donors, my brother and my wife, for making it possible for me to function at this level.